Hello everyone, myself Shivam Gore, and today daily task topic is the blood pressure. To discuss the what is meant by blood pressure. Blood pressure is the force exerted by the circulating blood against the walls of blood vessels, and it is measured in the millimeter of mercury mmHg and recorded by two numbers, systolic pressure and diastolic pressure. First one is the systolic pressure. Systolic pressure is the higher number which represent the pressure in the arteries when the heart beats. And second one is the diastolic pressure. Diastolic pressure is the lower number of which represent the pressure in arteries when the heart is at the rest between the beats. Now to discuss the normal blood pressure range. Normal blood pressure is the less than 120 to 80 mmHg, and the normal range, and the evaluate to the systolic is 120, and 120 to 130 mmHg, and the diastolic less than 80 mmHg. The hypertension stage first is the systolic. Systolic pressure is the 130 to 139 mmHg, or the diastolic pressure is the 80 to 89 mmHg. Hypertension stage 2 is the systolic. Systolic pressure is greater than 140 mmHg, or the diastolic pressure is the more than or equivalent to 90 mmHg. And the hypertensive crisis is the systolic pressure is the one greater than 180 mmHg, and the diastolic pressure is the greater than 120 mmHg. Requires the immediate medical attention, or the hypertension crisis is the very dangerous to and suddenly death for this stage of the hypertension. And now to discuss the how blood pressure is measured. Blood pressure is measured using a device called the spongioglometer, or the electronic blood pressure monitor. The first is the wrapping of cups around the underarm, and second one is the implanting the cup of the temporarily stop blood flow. Third one is the gradually releasing the blood pressure while lifting the blood flow, or the leading the walls. uh, Now next to discuss why is blood pressure is important. The proper blood pressure ensure the efficient circulation of blood, supply of oxygen and nutrients or tissue, remove of waste products. High and low blood pressure can be disturb these functions and lead to the compliance. Next to Now to discuss the factors influencing of blood pressure. The first one is the lifestyle. Lifestyle is the include the diet, physical activity, stress, and sleep is most important. Medical condition, the heart diseases, kidney problems, or the endocrine disorders are the important for the factors influencing. And the medication, some drugs can be raise the lower blood pressure. Next one is the age and genetics. Older age and family history of hypertension can be increase the risks. Now to discuss in detail the management tips of blood pressure. The healthy diet is the eat more fruits, vegetables, whole grains, and lean proteins, limited salt, saturated fats, and added sugar. Regular exercise, em for at least 2 hours of mandatory for intensity to daily exercise. and stress reduction to use the yoga, practice of yoga, medication, and drip breathing, and to daily exercise, limit of alcohol and caffeine. Do not consume the alcohol. To excessive consumption can be rise the blood pressure. Monitoring the blood pressure to regulate or daily check the blood pressure. And the cause now to next to discuss the causes of blood pressure. First causes to the high blood pressure. High blood pressure is the obesity, stress, genetics. They are the complication, the heart attack, stroke, kidney damage, and the low blood pressure, the cause of the dehydration, blood loss, endocrine disorder, complies the dizziness, fitting, shock, and in some cases. Thanks for watching my video. Thank you.